Thank you for watching this short video on the second half of the Caregiver Applicant Preferences. If you missed the first video on this section covering the caregiver setup, be sure to check out video 4. In this video, we will touch on how you will follow up and communicate with caregivers. You can specifically make sure caregivers agree to care plans, ensure they stay updated on their certifications, and organize each caregiver based on class. You will also learn how to keep track of evaluations and visit blocks. To start, go ahead and click on Admin. This will bring us back to the Caregiver Applicant Preferences tab. We can click on right there. And then we've already covered the first half. So we'll begin with this Caregiver Care Plan Signatures. Enable this if your state requires caregivers to sign that they have read their care plan. This will certify that the caregiver knows the tasks required by the client and can be done on a tablet or on a PC. Unfortunately, signatures cannot be processed on the mobile app at this time. Under the Caregiver Classes section, you can differentiate levels of class. For example, resident nurses versus companions. Usually abbreviations are used as codes, and the label would then be the full name of the caregiver class. You can see here RN for resident nurse, COM for companion, and you can add as many codes and labels as you wish. The certification area is where you put in anything that might expire. This would be things like their CAN license or a TB test for caregivers. The default expiration length will prompt a message in that amount of time, letting them know that a specific certification is about to expire. The caregiver evaluation section is used exactly the same as the certification section, but is usually used more for in-house evaluations, maybe like an annual performance review. You can add and remove as many of each code, certification, and evaluation you would like. And please remember that once you enter information in the certification and evaluation area, to not change the order of them. This will edit the selections in their profile. The following section, Apply Online feature, is usually left enabled, as this will add any online applicants into the software under Applicants. The following option, when enabled, can be useful for allowing applicants to directly upload resumes and photos with their application. The Recommended Caregiver section gives agencies an option to sort how caregivers are recommended first. The default setting uses distance as the only sorting stipulation, but you can change the option to seniority, then distance. When you change the option to seniority, then distance, this takes into consideration past histories with caregivers, understanding that there may be a caregiver that works extremely well with a particular client, although they may be slightly further than a different caregiver. If your agency ever hosts more than 250 caregivers, be sure to slide the maximum caregivers display up so you can see all available caregivers. Moving on to the next section, Caregiver Block Reasons. These options allow agencies to block a caregiver from a client, explain why a caregiver is unavailable, or block caregivers from a certain date. These options will be available on a drop-down menu when you choose to block someone. Also, certain options will show up when a caregiver may need to call out from work. Finally, Caregiver Points is a tally system that helps you keep track of anything you wish. Many agencies keep track of their client complaints or number of callouts. Many agencies find this highly useful for reviews, as you can add or subtract points from each individual caregiver. You can find a report of changes made to this area under Reports, Caregiver, and then Caregiver Points or Caregiver Points Log. The Caregiver Points Log will give you the report.